The topic of today's discussion is about weight loss in diabetes patients. Starting from the patients, those that have diabetes. Actually, we have different types of diabetes patients, but the very common are type 1 and type 2. Now, type 1 diabetes, first of all, I will give you a theme, understanding the concept. As you get the concept, then it will be very easy for you guys to understand the mechanism of fat reduction, fat loss, or weight loss. Weight loss, fat loss, weight reduction. All these are actually interrelated. Well, so our main focus is weight loss in diabetes patients. So diabetes patients are actually of two types, type 1, type 2. Type 1 diabetes patients, they do not have insulin. Why? Because the cells responsible to synthesize or to form insulin are actually known as beta cells. And in type 1 patients, these cells are being destroyed due to certain other diseases, due to certain other reasons. So, in short, insulin is not available. Sufficient insulin is not available to do the job. Now, what is the job of insulin? Wait for a while, I'll tell you. Come to the point. In type 2 diabetes patients, there is insulin available, but the sensitivity is not observed. Means cells are not sensitive enough. Insulin sensitivity is not observed. Due to which, what happens? The job of the insulin is not accomplished. In simple words, insulin does not play its job. So now, what is the job of insulin? The question. Okay. Well, insulin, it plays a very important role. That is, it is responsible to bring the glucose into the cell from the blood vessels. So here we have blood vessels. In the blood vessels, there is glucose. Whatever you eat, so that is actually absorbed. Okay, and glucose alongside is absorbed and is moving in the blood vessels. Now here is the job of insulin. That is to bring this glucose from the blood vessels into the cells. And our cells, when these glucose enter into the cell, then there is metabolism being observed. After the metabolism of the glucose, the ATP is synthesized. This is the normal job of the insulin. Now, in our diabetes patients, insulin is not available for doing its job. In one side, we don't have insulin. Here we have insulin, but there is no sensitivity. So now, what happens then when the job of insulin is not accomplished? I mean, in short, when insulin is not performing its job, the happening is actually simple. We use two types of fuels. Number one, that is glucose. Number two is fats. Normally, in normal individuals, the glucose is metabolized to do the synthesis of ATP, that is energy. So insulin in normal guys, this insulin will bring the glucose from the blood vessels into the cells, where it will be metabolized and ATP will be synthesized. So now, if there is no insulin, so the glucose will remain in the blood vessels, and ATP is not going to be synthesized. So means insulin job is not done. Okay. So here is joblessness, joblessness of insulin. So what happens then? Then the body of the particular individual shifts towards another way of obtaining the ATP. We need ATP to do the jobs of daily activities. So what happens then? This pathway shifts towards the next pathway. Glucose is not synthesizing ATP. Now what is happening? The fuels, that is actually the fats, the next one. Now these fats are actually metabolized to synthesize ATP. In the meanwhile, during the metabolism, there are actually products produced like ketone bodies, which are responsible to cause some other dangers also to the human. So, well, what is happening hereby? The body is shifting towards another way of fuel production, another way of fuel utilization, that is fats consumption. So, when fats is consumed, ATP synthesized, the case is obvious. Fats is consumed, ATP synthesized, weight is lost. So, weight reduction is actually seen in the patients. So, the mechanism is actually the glucose is not doing job, and ATP is not synthesized from the glucose. Glucose remains in the blood, and the fats is then actually the target for the ATP synthesis. So like this, when the fats are actually metabolized, so obviously the weight is actually reduced, reduced. So that's the entire mechanism. I hope you got. If still you have any kind of confusion or question, you can drop that in the comment box. And thank you for watching.